a quite common disorder affecting many people who typically don't even notice any symptoms. Now, in order to gain a better understanding of pharmacology of antihypertensive agents, first we need to review a basic physiology of blood pressure regulation. So when we talk about blood pressure, we are generally referring to the force or tension of blood pressing against the artery walls. Now, this pressure in the arteries is maintained by, among other things, contraction of the left ventricle, systemic vascular resistance, elasticity of the arterial walls, as well as blood volume. In other words, blood pressure is simply a product of cardiac output and systemic vascular resistance. There are a couple of major systems involved in blood pressure regulation. First, arterial blood pressure is regulated by pressure-sensitive neurons called baroreceptors located in the aortic arch and carotid sinuses. So, for example, if blood pressure falls too low, those baroreceptors can send signals to the adrenal medulla, causing release of catecholamines and thus increase in sympathetic activity through activation of alpha and beta receptors. So, activation of beta 1 receptors causes increase in heart rate and stroke volume and thus increased cardiac output, which leads to increase in blood pressure. On the other hand, activation of alpha 1 receptors on smooth muscle causes vasoconstriction and thus increase in vascular resistance, which again leads to increase in blood pressure. Now, another major system involved in blood pressure regulation is the renin-angiotensin-aldosterone system. So, we also have baroreceptors in the kidneys that respond to fall in blood pressure or reduction of blood flow by releasing enzyme called renin. Additionally, renin secretion is also stimulated by sympathetic activation of beta 1 receptors in the kidneys. Now, renin is necessary for the production of angiotensin II. Angiotensin II is a very potent vasoconstrictor which constricts systemic blood vessels, thus increasing peripheral resistance. Angiotensin II also constricts renal blood vessels and stimulates aldosterone secretion, which leads to sodium and water retention, thereby increased blood volume, cardiac output, and ultimately increased blood pressure. Now let's switch gears and let's talk about antihypertensive agents. So there are several major classes of antihypertensive drugs which work by interrupting different parts of this blood pressure regulating system. First, we have alpha-1 blockers, such as doxazocin and prazosin, which block alpha-1 receptors on the smooth muscle, thus causing decrease in systemic vascular resistance and ultimately decrease in blood pressure. Next, we have selective beta blockers, such as atenolol and metoprolol, which selectively block beta 1 receptors on the heart, thus causing decrease in cardiac output and thereby decrease in blood pressure. As you may remember, we also have non-selective beta blockers, such as labetalol and carvedilol, that can additionally block alpha 1 receptors and thus simultaneously decrease vascular resistance. Furthermore, beta blockers can inhibit beta 1 receptors present on the kidneys and thus suppress release of renin, formation of angiotensin II, and secretion of aldosterone. So these effects result in decrease in systemic vascular resistance and again fall in blood pressure. To learn more about alpha and beta blockers, make sure you check out my video about adrenergic antagonists.